I'm going to take a little bit of time to talk about what exercises medicine is and how it is important for chronic care in the case of disease and chronic disability. Exercises medicine began in 2007, and I'll have a video that is linked in Top Hat for you to watch and a couple questions that go along with it. So the initiative was about two components. Well, I guess I could say three. One is that they are guidelines. The guidelines mean that they are not directives, but they are a way to give you a starting point for making recommendations for an individual wanting to start an exercise program if they have a disease or if they do not have a disease. So they're guidelines. They are also prevention. So there is a prevention. If a person begins to follow those guidelines, it decreases the likelihood of getting chronic disease. But they also provide you guidelines for the treatment of chronic diseases. Now there are guidelines for many diseases, but not all. There was a news update in May of 2018 which indicates a little bit of an overview, of a broad overview of what the exercises medicine is about. So you'll see, number one, it's thought of as a prescription. So a prescription gives you a stronger emphasis of how to view what exercise is, and it's thought about being a major or an important component of care for physically, to keep adults physically active for prevention and treatment of a variety of diseases. So you'll see that there is a little bit more about what the long-term vision is, and it has to do with a vital sign, provide brief advice, and also give a little bit of information about improving health. So exercise does have a benefit in just general health, but there is also some specific benefits that are important for individuals that have chronic disease. And you'll see that it's not just about weight loss or looking good, but there's quite a bit in terms of quality of life, decreasing stress, anxiety, improving depression, helping a person live a longer disability-free life, and also to slow down the progression of the disease. So there are benefits not just for the healthy individual, but also for an individual that has a disease. And what you will find is sometimes people will say, well, I'm so sick, why bother? Well, this is where you can talk to that individual about feeling better, a better quality of life, having a little bit of the potential for maintaining or the potential for improving depression, for people to understand more in terms of what they are going through. So it's important to recognize there are differences of the benefits for individuals with chronic disease, and they also have different needs and desires. This figure shows you why exercise is important in terms of cost. So I want to draw your attention to a couple components on this figure. So the first is if you look at the y-axis, it has mean adjusted costs. So this looks at total costs of healthcare. The first two bars are for individuals that have diagnosed cardiovascular disease, and the remaining bars are for individuals that do not have cardiovascular disease diagnosed, and it's subcategorized into their risk factor. Do they have a poor profile, an average profile, or an optimal profile. And then each one of those categories, whether they have their level of profile for cardiovascular risk, and that would be like diabetes, obesity, hypertension. So we're looking at their regular risk factors. Do they participate in the optimal amount of physical activity? Which, if we just look at the cardiovascular disease, the first two bars on the far left, there is non-optimal physical activity and optimal physical activity. So we have further coloration, and it's how much prescription medication money is spent on prescription medication, how much the pink hash has to do with hospitalizations, how much money is spent on hospitalizations. The black is emergency room visits. The graph style, outpatient visits. And the top bar is other, and that would be like vision, home health care, medical devices, and etc. So each one of these bars, whether they have optimal or non-optimal physical education, if we compare just the pairs, you'll see that the individuals that are in each classification, just looking at physical activity, the cost is lower. And it's significant, especially in individuals that have known cardiovascular disease. You'll see that they have less medication, less hospitalizations, and fewer costs or less cost in emergency room visits. And then as we look at the pairs, the three pairs of poor, average, and optimal, you'll see a decline in costs associated with each, with the lowest being if someone has optimal. So the optimal risk factor, or in other words, the best cardiovascular risk profile with optimal physical activity, has a much lower healthcare cost than a poor cardiovascular risk factor profile with even optimal physical activity. But you'll see that the costs are very significant when someone has disease, and it's much lower if they have limited risk factors and they're physically active. It really starts adding up when you have people that have a poor profile. So the costs are, this gives you an idea of just the role that physical activity plays for individuals that have in relationship to their cardiovascular risk factor. So the exercises medicine includes the role of the physician, and the goal is the addition of the clinical component and tying in with all of the healthcare team. So when the individual goes into their annual exam, the primary care physician will will ask a couple questions associated with health risk appraisal or health risk assessment. What are your signs and your symptoms? Every single time you go to the doctor, you fill that stuff out, and also ask you about your exercise habits. And so when the physician gets that information, they can either encourage a person to exercise more or refer them to a program that will meet their particular needs. So the exercise vital sign, or EVS, has to do with how many days the person is participating in moderate to vigorous physical activity, and then how many minutes. Now you'll know that the goal is 150 minutes per week. And so when a person is asked this question, a patient or a client is asked, well, how many days per week do you go on brisk walks? They'll identify 2. Well, how many days, how long are your brisk walks? 15 minutes. Well, they're not meeting the recommended number of days or number of minutes that is accepted as appropriate. So that's the optimal physical activity. And we know that when people when people initially start in their youth or their young adulthood and they have health behaviors that may or may not be important or may or may not be assisting them to stay healthy. So for example, risk factors such as being inactive, smoking, maybe they're drinking excessively, not getting enough sleep, that perhaps they have a predisposition and they have become deconditioned and they get diagnosed with a disease. So if we can start with maybe they're pre-diabetic or diabetic. As a person continues down that path with those negative lifestyle factors and they don't make the changes that are necessary, they can become more deconditioned and their disability, maybe they go from pre-diabetes to diabetes, and movement becomes, maybe their weight becomes prohibitive to be able to participate in exercise or what they're perceiving that to be, and their disease worsens and worsens, and maybe other signs and symptoms and other diseases come along. Maybe they get hypertension, maybe they have some atherosclerosis. Then ultimately there is a movement to infirmity, which is a person inability to take care of themselves. So this downward spiral is how a person can get to frailty, which we're going to talk about later. So what we find is that death and chronic disease is more likely associated with these behaviors. So smoking being one of the major one. Physical activity, you'll see, is also a large component causing that cause of death on the fulcrum being a much heavier component or a bigger contributor. Sun exposure, poor diet, stress, all of those can contribute to a variety of chronic diseases. So obesity, diabetes, cancer, and also complicating diseases such as multiple sclerosis. So we're looking at the lifestyle factors, in many cases choices, how we react, as being the greater contributors to causes of death. It's not medical errors, it's not genetics, and it's not infectious diseases. And so where exercise comes in is we think about it as primary, secondary, and tertiary prevention. So primary prevention means that a person doesn't get the disease. So in other words, if you are not smoking, you're having a good physical activity, wearing sunscreen, drinking in moderation, etc., that a person is less likely to get the disease such as cancer. Secondary is getting diagnosed early and you don't get the worst possible disease. So it's caught early, it can be managed, and perhaps the stepping forward of a worse disease is stopped. Tertiary is when a person has the disease and improve the quality of life. So here is an example of where we're looking at exercise as a role in not just prevention, but in some cases, tertiary prevention, not primary prevention, but tertiary prevention, improving the quality of life, improving the person's ability to take care of themselves, to have better joy, much more happiness in their life. That's where we get the prevention component, and exercise can fit in all three of these. Now with secondary, that's often again catching it early. That's going to be diagnosing it early, but exercise can also help to decrease the progression of the disease in many cases. So your assignment for the next class session is to look for an exercises medicine document and get familiar with it. Download it to your desktop and bring it for the next class session, because we're going to do a little bit of evaluating of these documents, okay? So you're going to search exercises medicine, and one of the diseases, you can choose one of the diseases that you've been assigned as a topic, and but you should have 2 topics, so do your best. If you don't find one, then you can look at one of the other diseases and use that instead. So that is the plan. We'll see you at the next class.